This story is sponsored by AIM Acupuncture and Integrative Medicine.
Well, welcome back to Living Local Carolina. Today I am at AIM Acupuncture and I'm talking with my friend, Miss Carolyn Price. How are you doing?
I'm doing well. How are you doing?
I'm doing good. Now, we've already been talking all morning about why you are here and what you've been dealing with for quite some time now.
Right. I started out with severe headaches that just wouldn't go away, and my chiropractor worked on it some and it didn't seem to help. I've done physical therapy, and that gave me some really good exercises that I can do the rest of my life to help with the mobility, but the pain was still there. So I talked to Dr. Tanya because I've seen her before, and she said, yeah, we can do that. So I've been seeing her for several months now, and the pain is a lot better. It's tolerable, and with a few more treatments or maybe like a maintenance program. With a maintenance program, a couple of times a week for however long it takes, the pain will eventually probably go away. The main thing that I want to do is avoid having to take pain pills and have surgery. If I can avoid that, then I'm good.
You want to get back to doing the things that you love, like
I do.
gardening.
Yes. I'd like to get back. I mean, we're at the beach, you know. But yeah, it does kind of put a damper on your ability to do things when you're in pain.
And a big reason why you came here to AIM is because you've had acupuncture before in the past. You know that it works.
I have. I came to Dr. Tanya actually I had trigger finger in my thumb. I have a lot of arthritis in my hands, and my thumb had locked up. I could bend it that way, but I couldn't bend it that way. It was locked up at that joint. So she said, sure, we can do that. And so, hey, I finished up treatment right before COVID hits, and I can still move it. It's there. And I had acupuncture once before. I had tennis elbow or tendonitis in my elbow, and my chiropractor that I was seeing at the time, he also did acupuncture. And when I mentioned it to him, he said, "Oh, let's go ahead and take care of it." Yeah, and that's been 15 years ago, and I've not had any trouble with it at all.
That's the coolest thing about acupuncture is it can actually treat it and it does not come back, which is so cool.
Exactly. And I feel like anytime you can have a treatment that works this well and do it without pain pills, without surgery, you're going to come out ahead.
I love that. And I wanted to ask you too, for somebody out there that might be on the fence about trying acupuncture for whatever, why would you recommend AIM?
I would recommend AIM because Dr. Tanya, she's very smart. She knows what she's doing. Every time, the last time I was in here, the first time I was in here to see her, she had a group of 25 doctors that she was training. She trains doctors all the time. She's really good at what she does. She knows what she's doing. So I trust her.
Now, what are you looking forward to most once you're able to get all these treatments done? What are you looking forward to getting back to?
Well, the main thing, I would like to be able to sleep all night without being in pain. But the main thing, I would like to get the pain to the point where I can at least sleep all night, without waking up in pain. Once I get up and get going, it's better. It doesn't completely go away, but it's better. But that's because of the things that's not going to go away, And so, but with the pain management that she's doing for me, I'm hoping that that's going to get better.
Well, we're all rooting for you.
Well, thank you.
This story is sponsored by AIM Acupuncture and Integrative Medicine.